administration. So BSI, scene safety, or standard precautions. So I'm going to come up to my patient, appearing, he's probably going to be in some type of respiratory distress. So I know that I'm going to be administering some type of medication, whether it's albuterol or ipratropium bromide, which is Atrovent. So what I'm going to do is I'm going to assess his work of breathing. I'm going to ask the patient if he has any known allergies, if he's taking any medications before I administer this medication. So I'm going to grab my nebulizer. I'm going to have it all hooked up and ready to go. I'm going to have my medication ready as well. I am going to then tell the patient what I'm going to do. So, sir, ma'am, I'm going to have this mask right here filled up with medication. I'm going to connect that to this oxygen bottle. What we're going to do is I'm going to place this over your head, placing it on your face, and you're just going to breathe and inhale, and I'll coach you through the process. Whenever I say to inhale, inhale, and whenever I say to exhale, you can do so as well. So what I'm going to do is I'm going to assess my medication, making sure that this is the right patient. So this is the patient that I will be administering the medication. The right medication, which is right here. And in order to see that it is the right medication, I'm going to look at the date. I'm going to look for the clarity, making sure that I don't see any discoloration. And then I'm going to note the time of this administration of medication. So after looking at the expiration date, so on and so forth, now I'm going to note the correct route. So I will be giving this via inhalation by blow-by nebulizer mask. So now I'm going to insert the medication into the nebulized vial. Now I'm going to connect the mask. I'm going to hook the blow-by mask up to oxygen. Okay, now I'm going to see that it is misting. Once it is starting to deionize, I'm going to place this over the patient's head. So if I see that they become uncomfortable or anything such of that nature, I can then go to a handheld nebulizer. So I'm going to place this over the patient's face, making sure that I do not disrupt the patient in any way. I'll ask the patient, does that feel comfortable? If yes, perfect. So now I'm going to just let the patient breathe. So I'm going to coach the patient. So sir or ma'am, could you just follow my breathing? So deep breath in, deep breath out. So breathe through your nose, breathe out. So in through your nose, out through your mouth. And I will continue to coach this patient whenever needing to do so. I will let this patient breathe up all the fluid of Atrovent or albuterol. While doing so, I'm going to assess the patient's work of breathing. So I will then listen to his lung sounds, noting of any positive or negative indications. So I'm going to listen to his lung sounds. So take a deep breath in for me. Breath. 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 Alrighty, so I will take note of any positive or negative effects of this medication. I will then remove the mask once the nebulized treatment has been given. Alrighty, I'm going to remove it, continuing to assess his work of breathing.